Diabetes is a life-altering diagnosis as your lifestyle will completely change, and this can greatly affect your mental health. In order to manage your diabetes, you will need to establish a new day-to-day routine as well as create good habits. This includes changing your diet and eating a well-balanced meal, avoiding sugary beverages and certain kinds of foods, exercising regularly, monitoring your blood glucose level, and taking medications. With this sudden change in lifestyle, it may feel like a threat to a person's way of life. You may start to feel overwhelmed and emotionally drained by these changes, making it difficult to carry out important tasks and managing your health. However, managing your mental health is just as important as managing your diabetes. Just as you measure your blood glucose level every day, you need to take the time to check in on your mental health and be aware of how you are feeling mentally. If you have diabetes, you may have an increased risk of developing depression. So how exactly are these two related? Depression can greatly affect how you perform your everyday tasks as well as your ability to communicate and think clearly, and as a result, this can lead to poor diabetes management. Additionally, depression can cause you to make poor lifestyle decisions such as smoking, making poor food choices, exercising less, gaining weight, etc., which are all risk factors for diabetes. According to data and research, depression affects 1 in 4 adults with diabetes, with rates ranging from 21.3% in adults with type 1 diabetes and 27% in adults with type 2 diabetes. People living with diabetes often feel overwhelmed due to the sudden change in lifestyle, and managing diabetes may feel like it's too much to handle. If you're constantly feeling emotionally burdened and stressed due to living with diabetes, you may have something called diabetes distress. Some common symptoms of diabetes distress include fear, frustration, overwhelm, defeat, loneliness, and denial. This may make it hard for you to take care of yourself and keep up with it daily. According to a study done in 2014, 42% of people with type 2 diabetes have anxiety, and women are more likely than men to experience anxiety. The cause of anxiety in people with diabetes may be due to many different reasons. For starters, people with diabetes need to test their blood glucose levels and take medications every single day. On top of that, they may be worried about trying new foods, traveling, healthcare costs, and any other diabetes complications. Diabetes can also lead to disordered eating. The different types of eating disorders include anorexia, bulimia, binge eating disorder, and eating disorders not otherwise specified. Anorexia is an eating disorder that's centered around the fear of gaining weight, which may result in self-starvation and excessive weight loss. Bulimia is characterized by recurrent binge eating followed by purging with methods such as vomiting, laxatives, fasting, severe diets, or vigorous exercise. Binge eating disorder is characterized by periods of uncontrolled and impulsive eating beyond the point of feeling full. Oftentimes, many people feel shame or self-hatred after binge eating. Eating disorders not otherwise specified is a range of other disordered eating and doesn't fit into the other types of eating disorders, which may include chewing food, then spitting it out, and binging and purging irregularly, such as when feeling stressed out. Eating disorders are highly addictive. They function like other addictions such as drugs or alcohol. Those struggling with eating disorders may be addicted to starving themselves, eating clean, purging, etc. Secondly, they are maladaptive coping mechanisms. Behaviors such as starving or purging are not just random behaviors that they are exhibiting. All these behaviors have a purpose. For example, someone may be starving themselves in order to numb out the emotional pain they are feeling due to a traumatic event that occurred. Usually, these behaviors are an indication that it is a much deeper issue that needs to be resolved. Thirdly, eating disorders are also deadly as they have the highest mortality rate of all mental illnesses. And lastly, eating disorders are usually embodied in a voice. Many people with an eating disorder would describe it as an abusive voice in their head that is always with them. So how does OT play a role in mental health and wellness? OTs can help by providing interventions for emotional and behavioral regulation to help increase focus and attention, enhance motivation, manage stress, conserve energy, and practice mindfulness. Additionally, they can work closely with clients to identify occupations and activities that are meaningful and important to them, and work with the clients to get back to doing the activities that they love. They can also help clients replace unhealthy activities with meaningful activities. OTs can also teach practical ways to cope with mental health issues. For example, they can provide different breathing strategies, such as the box breathing technique or the mindfulness breathing technique, to reduce anxiety or depression. OTs can also help structure and organize daily activities if they are having a difficult time with their daily routine. These are only a small piece of what OTs do to help with mental health and wellness. Ultimately, OTs have a huge impact towards improving the mental health and wellness of those struggling with diabetes. In moments we feel stressed or anxious, we can use our breath to calm our breathing. One simple exercise you can do to help feel more calm and relaxed is called box breathing. Before we get started, either sit in a chair, lie on your back, or stand. Just find a position that is comfortable for you. After you find a comfortable position, breathe as you normally would for a minute or two, and just observe the way you're breathing. Make sure that you are taking deep breaths to activate full relaxation. This exercise is a great way to recenter yourself in a stressful situation, and you can do this anytime and anywhere. So let's try this together. Now let's begin. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. One more time. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. Continue as many times as you wish until you feel recentered. How do you feel now? Do you feel more calm, relaxed, focused? Remember the simple breathing technique whenever you feel anxiety or stress to recenter yourself. The 5-4-3-2-1 grounding method is an exercise that is designed to ground you or help you connect with the present moment and avoid negative thoughts. The good thing about this exercise is that you can do this anytime, anywhere, sitting, standing, or even laying down. All you need is you and your 5 senses. Let's first start by breathing deeply. In through your nose and out through your mouth. Now let's begin. Look around you and name 5 things you can see in your surroundings. Do not overthink this. This can be anything in your sight. If you're inside, it can be the book sitting on your table or the plant in the corner of your room. If you're outside, it can be the grass beneath your feet. It doesn't matter what they are. You can either describe them in your head or you can say them out loud. And look at the details of the object. Try to focus on 4 things you can feel or touch. You can think about the chair you're sitting on. How does the chair feel? Is it soft? Is it hard? You can also think about the socks you're wearing. Are you wearing long socks? Short socks? Are they fuzzy? Do you feel cold? Do you feel hot? You can even pick up an object and see how it feels. Now let's focus on 3 things we can hear. Do you hear a dog barking? Or maybe a car driving down the street? Do you hear footsteps? Or if it's completely silent, you can also try making noise yourself. Next, name 2 things you can smell. It can be fresh laundry or flowers. Or if you can't smell anything, you can even bring something with a scent to your nose. Lastly, identify 1 thing you can taste. You can put a piece of gum in your mouth or candy. Think about the different flavors you taste while you're eating the candy. It doesn't have to be candy or gum. It can even be coffee you had in the morning. To end, let's take another deep breath. Notice how you feel. Use this method to ground yourself, to feel present in the moment, and to calm your anxious thoughts. Have you ever experienced back pain or neck pain or any other pain in your body due to anxiety or stress? One of the ways that the body responds to anxiety and stress is by muscle tension. One of the ways to reduce this muscle tension is by progressive muscle relaxation. So how does it work? We will be going through each muscle group one by one. First, start by inhaling, then tensing the muscle group for 4 to 10 seconds. Then, exhale and suddenly and completely relax the muscle group. Before moving on to the next muscle group, relax for 10 to 20 seconds. Notice how your muscles feel when they are tense and when they are relaxed. Once you have gotten through each muscle group, count backwards 5 to 1 to bring yourself back to the present. Let's try this together. Bring your attention to your legs. As you breathe in, tense your legs by making your legs as straight as possible. Hold that for 10 seconds. Now, relax as you exhale. Now bring your attention to your forehead and squeeze the muscles in your forehead. Hold for 10 seconds. Now relax as you exhale. Now squeeze your eyes tight shut and hold for 10 seconds. Now relax the tension around your eyes as you exhale. Next, inhale and puff air into your cheeks. Hold for 10 seconds. And relax as you exhale. Open your mouth as wide as you can. Feel your jaw muscles stretch and tighten. Hold for 10 seconds. Now exhale and relax and allow your mouth to gently close. As you inhale, tense your shoulders by pulling them up towards your ears. Hold for 10 seconds. Now relax as you exhale. Now bring your attention to your hands and arms. Clench your hands into a fist and straighten out your arms as straight and stiff as possible. Hold for 10 seconds. Now relax your arms. Lastly, straighten up your back and sit as tall as you can. Hold that position for 10 seconds. Then slowly relax your back as you exhale. Now that all of your muscles have relaxed, continue your slow breathing and take some time to enjoy the sense of relaxation. There are a variety of phone applications that you can access and use throughout the day in order to help improve your mental health and reduce symptoms of diabetes. The following applications presented are all free and can be easily downloaded and used anytime to help you when you need it throughout the day.